Hello and welcome. Today's presentation is on what we must know about the monkeypox virus to protect ourselves from getting infected. Over the weekend on the 23rd of July 2022, the World Health Organization declared that the monkeypox outbreak spreading globally is a public health emergency of international concern. This is the highest public health alert that is sent out by WHO. It has been announced 7 times in past. Last time being for COVID-19. A once-neglected zoonotic virus endemic to West and Central Africa, monkeypox virus was first identified in 1958 in non-human primates kept for research in Denmark. The first case in humans was reported in 1970 in the Democratic Republic of Congo in the Bulletin of WHO. The Poxviridae family are double-stranded deoxyribonucleic acid viruses which infect a range of animals including birds, reptiles, insects and mammals. The family consists of 2 subfamilies, Cordopoxvirinae and Entomopoxvirinae. Monkeypox belongs to the Poxviridae family, the Cordopoxvirinae subfamily, and the genus Orthopoxvirus. Orthopoxviruses are large virus, with size ranging from 140 to 450 nanometers. It has a brick-like structure and a genome consisting of approximately 200 to 500 kbp that codes for over 200 genes. Monkeypox is endemic in the tropical rainforest regions of Central and West African countries, notably Cameroon, Central African Republic, Côte d'Ivoire, Democratic Republic of the Congo, DRC, Gabon, Liberia, Nigeria, Republic of the Congo and Sierra Leone. There are 2 distinct genetic clades of the monkeypox virus: the Central African clade and the West African clade. The West African clade typically results in a more self-limited disease, with case fatality ratios estimated to be approximately 3 to 6%, whereas the Central African clade has historically been associated with higher transmissibility and case fatality ratios as high as 10%. Animal-to-human transmission occurs via bites and scratches from infected animals. Preparation and handling of infected animal products may also result in transmission. Human-to-human transmission is thought to occur via direct skin-to-skin contact with lesions on the skin, as well as through indirect contact with contaminated fomites, such as bedding or clothing. Transmission can also occur at close proximity through exchange of respiratory secretions containing live virus. Patients have typically presented with prodromal symptoms, including fever, headaches, chills, malaise, and lymphadenopathy, followed by development of a characteristic rash. Pain can be prominent, but it is not universally present, and pruritus can occur when the lesions are in the healing stage. Patients are infectious from the time symptoms start, presumed to include prodromal symptoms before the appearance of the rash, until the lesions scab and fall off, with a new layer of skin being formed. In rare instances, patients can experience complications of monkeypox, such as bacterial superinfection, encephalitis, pneumonitis, and conjunctivitis, keratitis. The rash usually starts in the mouth, and then spreads to the face and extremities, including the palms and soles. Each lesion begins as a macule and then progresses to papules, vesicles, pustules, and scabs. Unlike chickenpox, skin lesions due to monkeypox tend to be similar in size and typically present at the same stage. The number of lesions can range from 10 to 150 and can persist for up to 4 weeks. It is important to have a high index of suspicion for monkeypox infection and to be aware of the sometimes atypical presentations of the infection that have been described in the ongoing 2022 outbreak. When there is clinical suspicion for monkeypox, clinicians should ask about travel and sexual history and about any close contacts with people with a similar rash or suspected or confirmed monkeypox infection. Behaviors associated with close contact include sleeping in the same room, drinking or eating from the same container, living in the same residence, etc. More importantly, absence of travel history or absence of a specific known close contact with a rash or with suspected or confirmed monkeypox infection should not exclude the possibility of this diagnosis. The optimal diagnostic procedure for a patient with suspected active monkeypox infection is to obtain a specimen from a skin lesion to send for molecular testing by PCR. Ideally, more than one specimen should be obtained from 2 separate lesions on different parts of the body, and lesions should be unroofed to adequately sample virus-containing secretions. Certain laboratories can perform direct PCR testing for MPXV specifically, whereas others perform generic OPXV testing that requires confirmatory testing for MPXV at a reference laboratory. However, in the context of the current outbreak, a positive OPXV test can reasonably be concluded to represent a diagnosis of monkeypox infection before results from confirmatory testing are available. Cell culture provides virus strains for further characterization, but it is restricted to accredited biosafety Level 3 reference laboratories. Serological testing can potentially be helpful in epidemiologic investigations. The mainstay of clinical management for typical monkeypox infection is supportive care. Supportive care includes maintenance of adequate fluid balance, because of the possibility of increased insensible fluid losses from the skin, decreased oral intake, and vomiting or diarrhea. Other measures such as hemodynamic support, supplemental oxygen, or other respiratory support and treatment of bacterial superinfections of skin lesions should be considered where indicated. Another aspect of supportive care that has been described with previous OPXV infections is management of ocular infection complications, specifically resulting in corneal scarring and/or loss of vision. Antiviral therapy can be initiated, but it has limited clinical experience. For infection control, isolation of patient, decontamination of surfaces and use of PPE should be done. Surveillance, case investigation and contact tracing can prevent the spread of the disease. Thank you.